As the Delta variant continues to surge, local hospitals are also seeing spikes in other respiratory viruses and infections involving kids. Now on your side, Chandrea Thomas has more from an expert at Banner University Medical Center.
I spoke to a pediatrician who says while the number of kids being admitted to the hospital for COVID is growing, there are other respiratory conditions that parents should know about.
I agree with the American Academy of Pediatrics and CDC recommendations that we should all be wearing our masks indoors.
Dr. Helene Feldman is a pediatrician with Banner University Medical Center. She says she's seeing more patients these days, and she's not the only one. Aside from COVID, one issue is popping up at a time they didn't expect.
We are also seeing an uptick in RSV or respiratory syncytial virus in our patients, along with a host of other contagious infections.
RSV season typically runs from November through April, but doctors have seen at least 4 cases so far in the last month, and those numbers are expected to go up.
The good news is that most older kids and otherwise healthy children, as well as adults, do pretty well with RSV. We are most concerned about our very vulnerable premature infants.
According to Feldman, at least 5% of hospitalizations for COVID across Banner hospitals are kids. But nowadays, whooping cough, norovirus, and the common cold are peaking during the summer, a surge that typically happens in the fall.
The whooping cough, that was in between April and June. We had almost 60 cases.
But there are some ways to keep your kids safe.
Get them vaccinated against COVID and make sure that they see their pediatrician to ensure that they're vaccinated against all of the other infections that we have vaccines for. For example, at 11, they need that tetanus and whooping cough booster.
We're told that 39% of whooping cough cases in the state of Arizona were transmitted through contact at daycare centers.
I think because everybody had been protected and staying home and not really in contact with other people, once we all started getting together, we started seeing that in daycare facilities.
Chandrea Thomas, KGUN 9 on your side.
Dr. Anthony